Hi there, and welcome. I want to thank you for taking a moment out of your busy day to be here. Today's story might just reflect a part of your own journey, or someone you deeply care about. Because what you're about to hear isn't just about medicine, or burnout, or even recovery. It's about the human need to feel whole again. This is a story of transformation, not the flashy kind, but the kind that begins quietly, often in the middle of the night, when exhaustion finally outweighs ambition. From deadlines to dreams, my health transformation. Let's begin. Dr. Anya Sharma was, by all outward appearances, the epitome of success. At 38, she was the head of cardiology at a prestigious hospital in Manhattan, a published researcher, and a sought-after speaker at medical conferences around the globe. Her apartment, overlooking Central Park, was featured in architectural magazines, and her social calendar was a whirlwind of galas, charity events, and dinners with influential colleagues. Yet, behind the carefully constructed facade of achievement, lay a woman teetering on the brink of collapse. Anya's days began before dawn, fueled by copious amounts of coffee and a relentless drive to excel. She would arrive at the hospital before sunrise, poring over patient charts, consulting with residents, and preparing for complex surgeries. The operating room was her domain, a high-pressure environment where lives hung in the balance and where Anya thrived on the adrenaline rush. Her precision, her decisiveness, her unwavering focus under immense stress, these were the qualities that had propelled her to the top of her field. But the cost was immense. Sleep was a luxury she could rarely afford. Meals were often skipped or consumed hastily between appointments. Exercise was a distant memory. Her personal relationships suffered from neglect. Her husband David, a talented architect, had grown increasingly distant, their conversations reduced to perfunctory exchanges about schedules and household chores. Her friends had long since given up trying to make plans, understanding that Anya's work would always take precedence. The breaking point came during a particularly grueling week. Anya had been working non-stop for 72 hours, overseeing the care of a critically ill patient who had suffered a massive heart attack. The patient, a young father of two, had been clinging to life by a thread, and Anya had poured all her energy into saving him. When he finally succumbed to his injuries, despite her best efforts, something inside Anya snapped. She walked out of the hospital that night feeling utterly depleted, not just physically but emotionally and spiritually. The weight of responsibility, the constant pressure, the endless sacrifices, it all became too much to bear. As she stood on the sidewalk, staring blankly at the passing cars, a wave of dizziness washed over her. She stumbled, barely managing to grab onto a lamppost for support. A kind stranger rushed to her aid, offering her water and calling a taxi. Anya found herself back in her apartment, but it felt alien and unfamiliar. The elegant furnishings, the breathtaking view, none of it brought her any comfort. She collapsed onto the sofa, tears streaming down her face. For the first time in years, she allowed herself to feel the full extent of her exhaustion, her loneliness, her despair. The next morning, Anya called in sick, a rare occurrence that sent ripples of concern through the hospital. She spent the day in bed, sleeping fitfully and haunted by nightmares. When she finally roused herself, she felt a profound sense of emptiness. She knew that she couldn't continue living the way she had been. She had pushed herself to the limit, and she had nothing left to give. Over the next few weeks, Anya embarked on a journey of self-discovery, a quest to reclaim her health and her sanity. She started by seeking professional help, consulting with a therapist who specialized in burnout and stress management. The therapist helped Anya to identify the underlying causes of her exhaustion and to develop coping mechanisms for dealing with the pressures of her job. Anya also began to explore alternative therapies such as yoga, meditation, and acupuncture. She found that these practices helped her to quiet her mind, relax her body, and reconnect with her inner self. She started to eat healthier, cutting back on processed foods and caffeine, and incorporating more fruits, vegetables, and whole grains into her diet. She also made a conscious effort to get more sleep, establishing a regular bedtime routine and creating a relaxing environment in her bedroom. Perhaps the most significant change Anya made was in her attitude towards work. She realized that she had been defining her worth by her professional achievements, neglecting other important aspects of her life. She decided to set boundaries, to prioritize her well-being, and to say no to commitments that would further deplete her energy. She delegated more responsibilities to her colleagues, trusting them to handle tasks that she had previously insisted on doing herself. She also started taking regular vacations, using the time to travel, explore new hobbies, and spend quality time with her loved ones. David, initially skeptical of Anya's transformation, gradually began to notice the positive changes in her demeanor. She was more relaxed, more engaged, and more present in their relationship. They started going on dates again, rediscovering the spark that had once drawn them together. They talked for hours, sharing their hopes, their dreams, and their fears. They reconnected on a deeper level, rebuilding their marriage on a foundation of love, trust, and mutual respect. Anya's journey was not without its challenges. There were times when she felt overwhelmed, when she doubted her ability to sustain her new lifestyle. But she persevered, drawing strength from her support network and from her own unwavering commitment to her well-being. She learned to embrace imperfection, to forgive herself for her mistakes, and to celebrate her successes, no matter how small. Over time, Anya's health and her energy levels rebounded. She felt more vibrant, more alive, and more connected to the world around her. She rediscovered her passion for medicine, but she approached her work with a newfound sense of balance and perspective. She was no longer chasing deadlines. She was chasing balance, a holistic state of well-being that encompassed her physical, emotional, mental, and spiritual needs. 5 years later, Anya's life looked very different. She was still working as a cardiologist, but she had reduced her hours and taken on a more advisory role. She spent more time mentoring young doctors, sharing her experiences, and helping them to avoid the pitfalls of burnout. She also became an advocate for physician wellness, speaking out about the importance of self-care and promoting policies that support the health and well-being of healthcare professionals. Her apartment, once a sterile showplace, had been transformed into a warm and inviting home filled with plants, books, and artwork. She and David had renovated the kitchen, creating a space where they could cook together and share meals with friends and family. They had also adopted a rescue dog, a scruffy terrier mix named Max, who brought them endless joy and companionship. Anya's journey had taught her the importance of self-compassion, resilience, and the power of human connection. She had learned that true success is not measured by professional achievements alone, but by the quality of our relationships, the depth of our inner peace, and the positive impact we have on the world around us. She had finally found balance, and she was living a life that was both meaningful and fulfilling. Her journey wasn't without its bumps. Early on, Anya struggled with the guilt of delegating tasks. She felt like she was shirking her responsibilities, that she wasn't being a good doctor. Her therapist helped her reframe this thinking, pointing out that by taking care of herself, she was actually becoming a better doctor, more present, more focused, and more empathetic to her patients. One particularly challenging moment came when a former colleague, Dr. Klein, publicly criticized Anya's reduced workload. He accused her of being soft and unprofessional, implying that she was no longer committed to her career. Anya was initially hurt and angry, but she refused to let Dr. Klein's negativity derail her progress. She reminded herself that she was living her life according to her own values, not his, and that his opinion didn't define her worth. Another significant hurdle was learning to say no. Anya had always been a people pleaser, eager to help others and to take on new challenges. But she realized that she couldn't continue to spread herself so thin without sacrificing her own well-being. She started practicing assertive communication, politely declining requests that didn't align with her priorities. It was uncomfortable at first, but she eventually learned to set boundaries with confidence and grace. As Anya delved deeper into holistic health, she began to explore the connection between mind, body, and spirit. She discovered the power of mindfulness, learning to pay attention to the present moment without judgment. She incorporated mindfulness practices into her daily routine, such as mindful eating, mindful walking, and mindful breathing. These practices helped her to reduce stress, increase her awareness, and cultivate a sense of gratitude for the simple things in life. Anya also became fascinated by the concept of preventative medicine. She realized that many chronic diseases are preventable through lifestyle changes, such as diet, exercise, and stress management. She started incorporating preventative medicine into her practice, educating her patients about the importance of healthy habits and empowering them to take control of their own health. She even started offering workshops on stress reduction and healthy cooking at the local community center. One of Anya's most rewarding experiences was mentoring a young medical student named Sarah, who was struggling with burnout. Sarah was a bright and ambitious student, but she was overwhelmed by the demands of medical school and was starting to lose her passion for medicine. Anya shared her own story with Sarah, offering her guidance and support. She encouraged Sarah to prioritize her well-being, to set boundaries, and to find joy in her work. With Anya's help, Sarah was able to overcome her burnout and rediscover her love for medicine. Through her experiences, Anya became a staunch advocate for change within the medical community. She believed that the current system, with its emphasis on productivity and efficiency, was detrimental to the health and well-being of doctors and patients alike. She started speaking out at medical conferences, challenging the status quo and calling for a more humanistic approach to healthcare. Anya's advocacy work gained traction, and she eventually became involved in a national initiative to improve physician wellness. She worked with hospital administrators, medical educators, and policymakers to develop strategies for reducing stress, promoting self-care, and creating a more supportive work environment for healthcare professionals. David, inspired by Anya's transformation, also made changes in his own life. He had always been passionate about sustainable design, but he had been working on projects that didn't align with his values. He decided to start his own firm, focusing on eco-friendly architecture that promoted health and well-being. He found that his new work was more fulfilling and that it allowed him to make a positive impact on the environment. Anya and David's relationship continued to flourish. They made a conscious effort to prioritize their time together, going on regular dates, taking weekend trips, and simply enjoying each other's company. They learned to communicate openly and honestly, resolving conflicts with empathy and respect. They created a strong and loving partnership that was built on mutual support and shared values. Max, the rescue dog, remained a constant source of joy and affection. He accompanied them on their walks in Central Park, greeted them enthusiastically when they came home from work, and snuggled with them on the couch in the evenings. He was a reminder of the simple pleasures in life and the importance of unconditional love. As Anya looked back on her journey, she realized that she had come a long way. She had transformed herself from a burnt-out, overworked doctor into a healthy, happy, and fulfilled woman. She had learned the importance of balance, self-care, and the power of human connection. She was no longer chasing deadlines. She was chasing balance, and she had finally found it. One crisp autumn evening, as Anya and David strolled through Central Park with Max, Anya paused to admire the vibrant colors of the leaves. She took a deep breath, savoring the cool, fresh air. She felt a profound sense of gratitude for all that she had, for her health, her happiness, her loving relationship, and her fulfilling career. She knew that life would continue to present challenges, but she was confident that she had the tools and the resilience to overcome them. She had learned the most important lesson of all, that true health is not just the absence of disease, but a state of complete physical, mental, and social well-being. And she was finally truly well. In the years that followed, Anya and David continued to live their lives with intention and purpose. They traveled the world, exploring new cultures and connecting with people from all walks of life. They volunteered their time and resources to causes they cared about, making a difference in the lives of others. They embraced the present moment, appreciating the beauty and wonder of each day. Anya often reflected on her past, remembering the days when she had been driven by ambition and the pursuit of external validation. She realized that she had been living a life that was not her own, a life that was dictated by societal expectations and the pressures of her profession. She was grateful for the wake-up call that had led her to change her ways and to prioritize her own well-being. She also recognized that her experience was not unique. Many people, especially those in high-pressure professions, were struggling with burnout and exhaustion. She felt a responsibility to share her story and to inspire others to take control of their own health. She wrote a book about her journey, which became a bestseller and was translated into multiple languages. She also started a blog, where she shared her tips and insights on how to achieve work-life balance and cultivate a life of purpose and meaning. Anya's legacy extended far beyond her medical achievements. She became a symbol of hope and inspiration for those who are seeking a more balanced and fulfilling life. She showed that it is possible to achieve success without sacrificing one's health and well-being. She proved that it is never too late to change direction and to create a life that is aligned with one's values. And so, Dr. Anya Sharma, the former deadline chaser, continued her journey, chasing balance and inspiring others to do the same. Her story became a testament to the power of self-care, resilience, and the transformative potential of a life lived with intention and purpose. It was a story that resonated with people around the world, reminding them that true health is not just the absence of disease, but a state of complete well-being that encompasses all aspects of our lives. One late afternoon, several years after her book was published, Anya received an email from a young woman named Emily. Emily had been working as a lawyer at a prestigious firm, and she was on the verge of burnout. She had read Anya's book and had been deeply moved by her story. She wrote to Anya to ask for advice. Anya responded to Emily's email immediately, offering her support and encouragement. She invited Emily to meet her for coffee. During their meeting, Anya listened attentively to Emily's concerns and shared her own experiences. She offered Emily practical tips on how to manage her stress, set boundaries, and prioritize her well-being. Emily followed Anya's advice, and she began to make changes in her life. She reduced her workload, started exercising regularly, and practiced mindfulness meditation. She also sought professional help from a therapist. Over time, Emily's health and her energy levels improved. She rediscovered her passion for law, and she began to find more joy and fulfillment in her work. Emily's story was just one of many that Anya heard over the years. She realized that her story had the power to make a real difference in people's lives. She felt a deep sense of purpose and gratitude for the opportunity to help others. She knew that she had found her true calling, to inspire and empower people to live healthier, happier, and more balanced lives. Her journey from chasing deadlines to chasing balance had led her to a place of profound fulfillment and meaning. And she knew that she would continue to chase balance for the rest of her days, sharing her wisdom and inspiring others to do the same. Thank you so much for listening. If Anya's story touched something inside you, you're not alone. Burnout, pressure, and self-neglect are more common than we think, especially for those who care deeply and give endlessly. But here's the truth Anya discovered: you don't have to break in order to rebuild. You can begin today by setting one small boundary, taking one deep breath, or simply asking yourself, what do I need right now? If this story resonated with you, share it with someone who might need a reminder that healing is possible. And if you're on your own journey to find balance, keep going. You are worth the effort. Until next time, stay well, stay kind to yourself, and remember, you're not chasing deadlines anymore. You're chasing dreams.